Thomas, and I strained my anterior talofibular ligament.
Okay, how did you strain it?
I was playing basketball and I inverted my ankle.
Okay, stand up.
Okay. And this is the part right here that I strained.
And what was the movement that you strained it doing?
I inverted it like that.
What were the signs and symptoms that you had injured your ankle?
When I first injured it, the onset, it was pain. It was just like a lot of pain. And then swelling was after that. I needed ice to bring that down. And then walking was really hard too. Like you could just tell my ankle was messed up by the way I walked.
Give a description of the initial treatment procedures.
When I first went to the emergency room, they x-rayed my ankle and then they did the anterior drawer test on it. Then they also checked for joint stability and range of motion.
The ligaments on the lateral side of the ankle, specifically the anterior talofibular ligament, are important for stability. Anterior talofibular ligament injuries are usually caused by landing with toes pointed in and the foot inverting, often occurring when an athlete is running on uneven terrain, has stepped in a hole, or jumping and landing in an unbalanced position.
All right, the mechanism for anterior talofibular and ATF ankle sprain is usually when we come in, we have our distal end of our fibula coming into the talus, and the ligament runs roughly about this way. And it usually happens that an inversion ankle sprain or an ATF is our inversion, so it rolls in. And the way our maker made us, most of our ankle sprains come in with inversion. So we have about 85% of our ankle sprains are inversion, just due to the fact that with our anatomy, it rolls it in. And if you look at my chart, we come in, the way our foot is set up, it rolls and it'll roll onto the inside or inversion ankle sprain. So here's a picture of it right here. Here's my ATF. We roll it right in, comes down. We have our fibula, we have our tibia, we have our talus, we have our calcaneus. So right in this region, everything just rolls right in.
To ensure proper healing of the injury, adequate initial care and rehab is essential. Initial care would include rest, ice, compression, and elevation, or RICE for short. When doing rehab or strength and conditioning programs, the focus should be to gain full range of motion, restore balance, and rebuild strength.
Once we have determined that the injury is an ankle sprain, we obviously want to ice. There's a couple of different beliefs out there. You can ice for 20 minutes on, 40 minutes off, or 15 minutes on, 45 minutes off. It's all the same. Anything over 20, it starts to get into not doing much for the injury. So I like to just go 15 on, 45 off. But it depends on the athlete. As long as they keep the ice on, I'm happy. After that, we always want to make sure that once we're icing it, we want to make sure that it's elevated. We like to elevate it because gravity is our enemy. Everything is going to start coming down this way. The blood and the swelling is going to come down, get into his toes, not going to be able to go anywhere. So when we elevate it, we get it up above the heart, gets the blood and the fluid to go back into the body. To help that out, we can go ahead and do a simple ACE wrap, starting down at the toes, and we're going to try to go ahead and push the fluid, the swelling out of the ankle, wrapping up half on, half off. And I like to do this for when the athlete is not icing. So when they come into ice, 15 minutes on, 45 off, or 20 on, 40 off, every hour on the hour. When they ice, they can take this ACE wrap off. When they're sleeping, when they're going to school, work, whatever it may be, they should always have this on. For some of our simple ranges of motion, we start off, we want to go with what we call our ankle pumps. That's where we pull the foot into plantar flexion, dorsiflexion. So I'm just going to have my athlete pump it up and down, do a set of 15 each way, so we do a total of 3 sets on that. Then we're also going to go with inversion and eversion. So we're going to have them go in and out. The key as the athletic trainer or therapist is you want to make sure that the athlete is not rolling the hip. It's really easy to roll the hip because the hip is a ball and socket. They think they're getting the range of motion, but they're not. So it's in, out. Once again, 3 sets of 15. Then we can go ahead and pretend that our toe is a pencil. Then we're going to do the alphabet. So I'm going to have Robert go ahead and pump up and down, do the letter A, B, C, all the way through. So however you want to do it, 3 sets on that. Another one that we can do before we get into that, I skipped a step, but we can go ahead and do clockwise and counterclockwise. 3 sets of 15 on that. So we do our ankle pumps, and plantar flexion, dorsiflexion, inversion, eversion, circles clockwise and counterclockwise, then lead that into our alphabet. And then one other thing that we can do to get a little strength going as the athlete gets stronger is we can pull out our good old TheraBand. We can pull out our TheraBand and have the athlete hold it and push down, control it down and bring it back up. 3 sets of 15 that way. Have the therapist or athletic trainer hold it this way and pull it up. 3 sets of 15. Rolling for eversion, out, 3 sets of 15, and rolling it in for 3 sets of 15. One way that I like to do it is push down for 15, pull up for 15, eversion, inversion, take a break. So you do 15 each way and then do a total of 3 sets on that. The athlete will be able to go to return to play once he or she has completed all of her rehab, strengthening exercises, along with sport-specific activities. So whatever sport they're playing, if they can do their drills, their agility drills in practice without any pain or minimal pain, and be able to play up at about 85 to 90%, 85 to 90%. Stop for a second. The individual that is at risk for inversion ankle sprain or an anterior talofib ankle sprain is basically any active individual. It doesn't matter if you're playing sports or walking on the sidewalk. You can step wrong, roll your foot in, you can damage the ATF. So it's common with everybody. This is, like I said, 85% of all ankle injuries come from the ATF.